SFM.
Now, we all know that if we go for a job interview, we like to make a good impression. Now, most of us will just make sure we've got our best suit on and a tie if you're a man, or a nice suit or a dress if you're a lady. Make sure your hair's nice, make sure your shoes are polished, and make sure that you know what the job you're going for is, and you've done your homework. Apparently, this isn't enough for some people, and they're slightly changing aesthetically their body appearance to make sure that they're in the front line for getting the job. We can talk now about this to Dr. Zach Alley and to Blair French, who are both on the line now. Good afternoon.
Good afternoon.
Good afternoon.
So, it seems a bit extreme to me.
Oh, I think it depends on the treatment and the approach by the physician, because I think a lot of these aesthetic treatments can be done in a natural way where it just enhances some of the features that you already have and gives you a more youthful appearance. It's not about changing your appearance, it's about enhancing it.
But surely, if you go for a job interview, it's all about your ability to do or your possible ability to do the job, isn't it? I mean, yes, I say, you're obviously going to go in and make an impression by the way you look in terms of your dress, but why is it got so bad now? Are we so obsessed with people's body image that we've got to change our appearance to make enhance our chances to get the job?
I think fundamentally it goes back to the principle, if you look good, you feel good. So it's just giving you that little boost of confidence. And I think if it's done in a natural way with a high quality product and also with a physician that is trained well and educated in how to kind of, improve the appearance subtly and naturally, I think it's a natural approach to consider even.
So what sort of changes are we talking about?
So just to echo what Blair said, and your previous question as well. Yes, you're right. We are seeing a significant increase in uptake in aesthetic treatments, and awareness is certainly out there. And I think there's nothing really wrong with wanting to look after your appearance. And there's that common saying, you wouldn't go to a dentist with bad teeth, and it's something that we're seeing a lot more in this generation. The types of treatments that we tend to offer are not surgical. They're not operative, which means you don't need to go into an operation, go under the knife, have an anaesthetic, and stay in hospital for a couple of days. We're talking about simple cosmetic injectable treatments, which can do the same job in an outpatient setting. Now,
is that similar to Botox?
Yes, exactly. So Botox and dermal fillers, these are treatments that you can do which are not very invasive. They're simply an injection, just like having your blood tests taken. They're cheaper, obviously, so you don't have to have an operation. But most importantly, they're reversible and not permanent. Now, that tied in with a natural product and somebody who's experienced and knows the anatomy of the face very well, together can create a look which really benefits most clients. And that's probably why we're seeing the significant increase in the demand for the procedures.
And are bosses or those who are looking to employ people, are they... I don't want to use the word in a derogatory term, but are they taken in by these cosmetic changes?
Well, I think the cosmetic changes are done in a way that if you were walking down the street, you wouldn't automatically assume that individual has had a treatment. We don't want to go down the roads of the Katie Price and the ones who maybe have had a little bit excessive in their treatments. Not, that was a personal decision that she made. But I think it's the subtlety. So if these individuals walk into the office for their interview, it's done in a way that the person interviewing them would not make the assumption that they've had a treatment done.
And just echoing that point as well, I think the clientele that we see in practice varies according to the treatment that's requested. Somebody who's younger is not really looking for lifting treatments to the lower neck, for example, because they've already got some degree of natural anatomy. An older clientele would be looking at sort of softening existing features and slowly delaying that aging process, whereas somebody who's a bit younger is looking to prevent the aging process. So our treatments are very much tailor-made to be natural according to the age group of the person that we see. With regards to your question about bosses being taken in by this, I think what you'll see as well is many bosses also have these kind of treatments, and I think it's because it's so popular, and what you can achieve with it really is something that's sought out by many people. And more people, whether they express it or not, are actually resorting to these treatments because they're a lot safer when they're done properly.
I was going to say, I'm sure you don't have many that go wrong, but I'm sure people have had treatments that have gone wrong. I mean, was it the actress Leslie Ash?
Leslie Ash, absolutely, yeah.
And and there's a very public figure who was whose career could have been ruined by having some treatment.
Absolutely. I'm glad you mentioned that. I mean, this is a very important point and something that both Intraline and Derma Medical are trying to push forwards with in regulating aesthetic treatments. What you see a lot in the media is all the horror stories, all the things that go wrong with Botox and fillers. And often these treatments are carried out by people that are not very experienced or don't have that degree of anatomy knowledge where if something was to go wrong, they could correct it. With what we've created and what we're pushing for really is to make sure that practitioners are trained in a way which is safe. Landmark-based training, making sure you're injecting in safe areas with the right product at the right level. And even if something was to go wrong, learning how to actually manage that as opposed to just letting them be. Our notion really is prevention better than treatment. And it's always good to start subtle and top up rather than to be aggressive and go back, because it's harder to reverse that. And when we push that and make sure our clientele is aware of what's available, I think that's the real take-home message, and making sure things are done safely and effectively.
It still slightly worries me that people are, I suppose I know it's because people get these things done because they can, but I still find it slightly worrying that people feel so, if you like, unhappy with their body image that they feel they need to make those changes. Surely you need to learn to be happy in your own skin.
Absolutely, and I think you're right to an extent as well. I mean, we don't treat everybody. Everybody who does or wants a treatment has a consultation, and a lot of the time we end up saying no more than saying yes. So it's equally as important to turn around the person who doesn't need the treatment as it is to help somebody who does want a treatment. So we spend a lot of our time making sure the right candidate has the right treatment, and a lot of the time making sure that somebody who wants something doesn't have it once they're more informed.
And I just to add to that, I think at Intraline, the approach that we want to take is education, and we want to kind of help people or help facilitate that kind of thought process that a potential patient has to go through when determining if they want to proceed with an aesthetic treatment. One thing is that we do not want to push people into thinking that they have to. And even as a corporate culture, we really promote a healthy lifestyle in general. We live and breathe a healthy lifestyle at our company with corporate yoga, cold juices, all those kind of things. So I think it is just kind of giving people the tools that they need in order to make the right decision at the right time that's right for them.
But aging, for example, is a natural process. I mean, all right, you can do things like if you're don't like your hair graying, or you can tint your hair or colour your hair to do that. But I think to me, that's kind of as far as you need to go, because basically your body changes and naturally with age, and you should learn to live with that. And if it's something like a weight thing, then that is in your hands as well.
I think you touched on a really good point, is that it is a personal decision. And I think from your perspective, we're hearing that, you should age gracefully and naturally. And I think, since the beginning of, back in even Cleopatra days, as these types of treatments or anti-aging treatments have been going on forever, I think it's just coming to light more recently with, media and social media that it's being talked about more. And I think it's important to have this dialogue to ensure that, people are fully educated about what's available to them. And again, if they choose to personally proceed with a treatment, I think we have to respect that as an individual.
Just to follow on from that as well, thanks, Blair, is people that have these treatments, it's not always cosmetic. Sometimes it's therapeutic. And by that I mean people that suffer from physical problems that are deemed cosmetic in the NHS, like excessive sweating or jaw pain, or even people that had a stroke or cerebral palsy or some form of condition which affects the symmetry of the face. Things like that can be corrected and really give somebody a natural form of life. And I think that's something, again, that we're really pushing for, to make sure that it's available out there and people are aware and it's done safely.
And of course, there is the other thing is, if you haven't got the money to have it done, you could, you taking it to extreme, the less money you have, the poorer you feel, and that doesn't help the body image and your self-image either.
I mean, on that point, really, yes. I mean, the treatments aren't cheap. for a service, people should really be expected to pay for a service. But for some of these treatments, it's for people, it's not just about the money. It's about the result that they're paying for and the sort of difference it makes to their life. I mean, you can go out and spend £500 on a suit, or you could correct your sweating. I mean, it's an option. It's a decision that people can decide to make themselves, and we see people making these life decisions daily. It's just an awareness option for people, and it's something that we don't really force people to have, but make sure they're aware it's available, because there is a significant demand for this kind of work.
And I think I think there's a full range of preventative and restorative treatments. So, although at this time a derma filler or an injection might be cost effective for you as an individual, there's tons of other alternatives, creams, serums that are, at a price point that it might be a little bit more acceptable and doable for that individual.
So where can people go to find out more information?
I think from our end, from a product standpoint and education about, kind of the aesthetic treatments in general, Intraline.com is a great resource. We have a whole section on our website called Why Aesthetics, and it just kind of gives individuals a bit of a background about us as a company, the treatments that we offer, and the steps that they should go through in order to determine if a treatment's right for them.
Dr. Zach Ali, Blair French, thank you both for your time today.
Thank you very much. Thank you.